Are you considering a facelift, or do you think maybe in the future you would want to get one? Well, here's a great treatment. You don't have to go under the knife, and it is nice and preventative too to help lift your entire face. And it's called PDO Threads. And this is a very easy in-office procedure during which I will put in multiple number of threads on each side of your face to, again, lift it up. And the way we do it painlessly is oftentimes we will use a dental block. So I'm going to put some lidocaine in our patient's mouth to help numb this entire area down here. So that way she does not feel any discomfort with the procedure. Not that it's painful, but you know, it's always nice to be preventative in causing any discomfort as well. So, are you ready? Okay, so I'm going to have you open your mouth for me. And this is very simple, and I'm going to purposely shake you because that way, hopefully I'm distracting you a bit. And hopefully my arm is not jiggling in this video, but here we go. Okay, pretty easy?
Yeah.
Okay. So that is going to hit that nerve. That's going to cover this entire area, and it does feel a little bit funny. It's going to feel funny in just a couple minutes. So now I'm going to go down and do the bottom, the mental nerve. So here we go. Yeah, very simple. You're doing awesome. Good job. And here we go. La-di-da. So she'll feel numb for about an hour after this, but as long as she just feels numb during the procedure, that's what counts, right? Okay. So now we're going to go do the other side. I'm going to come, since I'm up here, I'm going to go down here again. Ready? 1, 2, 3. You're doing great. Good job. You're a star. Now it feels funky. All right. You doing okay? Is that hurting? Feels funny. Huh?
Just when you pinch my lip.
Okay, oh, sorry. Stop pinching your lip. Trying to be distracting and causing more of the pain. Okay, that's fine. I see how we work here. Okay, and then I'm going to come over and do the other side. Okay, and I'm going to go here. Ready? 1, 2, 3. Here we are. I'm doing great. All right. Almost done. And we are out now. All right. Oh, is this starting to feel funky over here?
Yeah.
Yeah.
It's very,
Weird.
Yeah.
All right. So that's our dental block. We're going to give that a few minutes, and then we're going to go on with the procedure. So I'll see you in a couple. So we have just done our dental block, and now we are going to still need to numb the area where I'm going to put the threads in. So I'm going to have you turn a little away from me that way because it's higher up than where the dental block is going to get. So this is just a little bit of lidocaine. Let's see, we're going to go right below. So you've got a little vein right there, so we're going to go right below that vein. 1, 2, 3. There we go. I know this is so not fun. Okay, there you go. Good job. And then we're going to do one more down low. 1, 2, 3, left, right there. I don't like that one more. Okay, so there are all different types of threads, by the way. The ones that we were using today are molded threads, and these threads last for a year to year and a half before they dissolve. So that's really nice. They dissolve on their own over time, but as they're in your skin, they're going to make you make collagen. So they're a procedure that keeps on giving. All right. Can you feel here? You can feel a
little bit, yeah.
So we'll give that a minute. And the threads come on a blunt tip cannula, and that's why we need to make a pilot hole so that way we can get into the skin to get the thread in. So you'll see what I mean when I show you what the thread looks like up close. Okay, let's see. Can you feel there now?
No.
Not at all right here?
It's like so tiny, it doesn't even, like I just know that you're there, so.
So we're gonna go right here. You okay? Nice. Okay, I like it. So far I like it, and that's what matters, right? So I don't know if you can see this. This is a blunt tip cannula. This is what the thread comes on. It's actually inside this cannula, and that's why these are really great, because she shouldn't bruise. As I go through her skin, the cannula is going to move the arteries and veins over because you can't puncture them because it's a nice size cannula. I know I keep saying that word, but that helps decrease the risk of bruising, and as I glide through your skin, I'm going to irritate some blood vessels. I'm going to irritate your skin cells, so they'll actually kick into high gear and make more collagen just by doing the procedure itself. Okay, you set?
Mm-hmm.
So you just let me know if you hate me, but this is it. Easy peasy. I'm going to just kind of sink down to here. It's a good depth. And that's it. So I'm going to remove the top little portion here. I hate this little stopper thing. I hate. So if anybody from Nova Threads is watching, going on record and saying I hate this little stopper thing up here, but okay. Now I'm going to just push the thread and push on you. Sorry. There we go. Thread number 1. How you doing?
Okay. Yeah.
Okay, good. Now we're going to go thread number 2. I'm going to go in through the same insertion spot. Let's get another little alcohol swab. All right. There we go. We're just going to aim a little bit higher now. You okay? The answer was yes. She's feeling great. That's what I heard you say. Okay, excellent. I'm getting out the stopper. And we're going to push that little thread down. I'm going to touch here. And then I'm going to take the cannula out. Awesome. You okay?
Yeah.
Excellent. So see, oh, that's going to be fantastic. All right. So now we're going to go a little lower. Okay. Open up another envelope of cannulas. Actually, I think I'm going to make a little separate opening because sometimes that one opening gets just really crowded with too many. So I'm going to just do one right next to where I was. Are you okay here? Can you feel that? There you go. Say no. Like I'm telling you what you're saying. Okay. Mm-hmm. Now I'm going to aim down towards your marionette. You're doing great. The nice thing about these is you can redirect them. You're doing okay?
Mm-hmm.
Sorry. We're getting very excited next door. That hurts a little. Let's go back a little. Okay. How about there? Is that better?
Mm-hmm.
Okay. Awesome. You doing okay here?
Mm-hmm.
Excellent. Okay. Let's get this one off. It's always good to know when you are uncomfortable, so that way I can redirect where we went. So let's do that here. Going out. Smile for me. Okay. Nice. That one may bruise, but it's okay. Just at the insertion spot.
Got arnica.
Yeah, good. Okay. We're going to go into the same spot, just direct it a little bit differently. And then what I'm going to do is I will cut off the ends so that way it won't be a focus of bleeding anymore if I get the ends out. If that makes sense. let's see. So this is always fun. I always like to pull on that. Okay, so we're gonna go a little bit higher. Same place. Okay. And then you got it. You got this. You're doing great. Are you feeling okay here? Is it an okay level? No? Okay, let's go back. No, that's okay. You need to tell me so that way I know.
Ooh, yeah.
Sometimes we're in the wrong. Sometimes we just need to redirect it a little bit. It shouldn't be painful. There we go. Nice. You good here? Weird, right?
Yeah.
Think about if we didn't have the dental block.
Yeah, I know.
And always afterwards, I always tell people, it's a little bit sore. Your face is going to be sore, so you probably not want to go out and get a great big hamburger tonight, because it'll be a little uncomfortable. So I think, and also sleeping on your back would be helpful, so that way you're not laying right on these guys. Better now that I'm out?
Yeah.
Okay, sounds good. All right, so let's cut the ends, and then we'll do the bottom one in a sec, but let's cut the ends of these off, because that way I can, if I can cut these ends off, then it'll stop bleeding, so.
Okay.
So this is, never feels good, so I'll just warn you, I'm gonna just pull on the threads and pull up. And this just helps fasten them in. Loving that. When we were doing our training on me, this part I hated the worst. So I understand what you're going through, yet I'm still gonna do it to you. Okay. And I have done these on myself. I mean, my partners did these on me. So I know what it feels like. I'll tell you what though, I really like the results. Someone just wants to bleed a little bit. Sorry. You doing okay?
Yeah.
There. Sorry.
I
know
can
you
feel
didn't like that one. Smile for me. Gotcha.
I feel it.
Okay, let's pull the other one that's down there. Okay. Let me see. Smile again. Okay, relax. Excellent. I know that you need to smile again. Okay. I'm gonna cut it now. Sorry, it's just a pause.
Oh,
Yeah.
okay.
So simple. Let's just get one at a time. Okay. No, okay. Okay, so we're gonna go do one along the jawline now. Can you feel this?
No.
Okay, there we go. Nice. All right, so now we're gonna put one along the jawline, which is always a nice one. Help sharpen up the jawline, which is, I think everybody likes that. Okay, turn away from me. Awesome. Here we go. Almost there. Okay, why don't we just stop right there? Okay, good. Okay. So I'm gonna grab that little stopper. Okay?
Yeah.
stopped. Alright. So we'll step her out. Just gonna push the little thread. Here we go. So there's really no contraindications to getting threads done. These are made of the same material that surgeons use in surgery. So if you've ever had surgery where a surgeon says, don't bother to come back for getting those stitches out because they'll dissolve, it's the same material. So you've probably already been exposed to it. All right, you're doing great. Let's cut the end of this one off. And, okay, good. I'm just going to bring the end of the skin right over the end of the thread. And if you want to zoom in, you can see what her downtime is. 3 little spots. That's it. Now we are on the other side, and I've already injected with some lidocaine, and we're going to just get our pilot channel. Here we go. Oh, really just like the ibuprofen you had earlier.
Yeah,
Just saying.
I'm so sorry. Oh.
But that's okay. It's alright. Just make me go faster, that's all. Alright. And going through our channel. There we go. Okay. You're doing great. So easy. Wonderful. And we're there. You okay?
Mm-hmm.
Okay, good. Okay. I'm being very mean to you right now. Okay, hang on. Let's pull this out. You okay?
Mm-hmm.
Let's get this out. There we go. Beautiful. Excellent. Next one. That's the thread. You can see the molding around it. And this is the end of it, but this is what's inside your face. So it grabs hold and keeps it up. People are always concerned their face is going to fall after time. It's going to fall with gravity, but it's not going to fall because the threads are in there. There we go. You are done.
Awesome.
How do you feel?
Good.
Oh, so you'll be sore for a couple days. Again, you're going to want to eat soft food and not open your mouth or do great big smiles for a few days. And then again, you'll get an instant lift, but it might be confusing the first couple days as to what your results really are going to look like because of the swelling that's happening.
Okay.
So just be patient for a couple days, and then I noticed mine about 2 weeks later. I was like, oh yeah, look at that. And then people say, like, every time I go to the mirror, I'm looking a little bit better, and I'm looking a little bit better. That's because you're starting to make collagen, and it takes 3 whole months to make collagen. So although you get that instant lift, now it takes 3 months to make collagen. But the fact that these are in here for 1.5 years before they dissolve, they're going to keep making you make collagen. So just because they're in there doesn't take out any possibilities for doing laser treatments or anything like that. You just need to wait about 8 weeks from now.
Okay.
You can do Botox, you can do filler. I really recommend doing microneedling after threads like this, because that'll only make you make more collagen. So I think that microneedling along with these threads is a fantastic duo.
So I could do scarlet?
You could do scarlet. I would have you still wait about 1 to 2 months, but again, it's a great combination treatment. You know, I'm all about the combo treatments. So, all right, you did great.
Thanks.
So, again, if you are thinking about a facelift, but maybe you don't want to do it yet, these threads, PDO threads, are a great option to help push that facelift off, or maybe you won't even need it then. So it's a great idea to try. You can see how quick it was, and relatively painless. At least I didn't feel it, so.
It wasn't bad at all.
Yeah, okay, good. So jowls, again, you can use them to lift your breasts, you can use them to lift your booty, your knees, your neck, even your eyebrows with these PDO threads. And there's many, many different types. So if you have wrinkles, if you have, forehead lines, if you have sagging eyelids, if you have lip lines, really just come and see us, and we can let you know if PDOs should be part of your treatment plan.